We're going to do a guided tour of the Full Plate Living nutrition resources today. I am Amy Hannes. I'm the program director here at the Ardmore Institute of Health, which is home of Full Plate Living. I also have our chief medical officer, Dr. Jonathan Bonnet, with us today, and our program coordinator, Michelle Jones. So sometimes you might see or hear our names and things behind the scenes, and so we are the ones that are bringing Full Plate Living to you. So I want to do a little bit of kind of an overview. If you're not familiar with the Ardmore Institute of Health, it is our private foundation that is home of Full Plate Living. So we, our mission is to enrich the health and vitality of people to live more meaningful and purposeful lives. Part of doing that is offering Full Plate Living as a free service to you. So everything I'm going to talk to you today is 100% free. And Full Plate Living helps people add more whole and unprocessed fiber foods to the meals that they're already eating. It's a small step approach that can lead, of course, we know, to big health outcomes. So we're, again, glad to have you here today and sharing this. So the Ardmore Institute of Health, we, actually, Michelle and I used to work at a facility that our foundation owned called the Lifestyle Center of America. And people would come and spend 2 to 3 weeks with us. We mainly ended up seeing type 2 diabetic patients. And so it was extremely expensive for us to fund, as well as expensive for people to come to us. So in 2008, we discontinued doing that residential program and said, how can we reach more people, and what is a small step approach they could do? And we knew that changing our nutrition is a big key of that. And so we published the book called The Full Plate Diet Book in 2010, which was a New York Times bestseller. And then from that, because people knew we knew programming from our residential program, they said, would you have a program to go that? And we said, no, but we will create one. And so a lot of these have really branched out of these 2 items here. So I want to kind of give you just a little bit of background on that. Just to let you know, too, Full Plate Living is a certified program from the American College of Lifestyle Medicine, so if you're familiar with them. And I just thought I would do a quick little overview of Full Plate Living and our approach if you're not familiar with it. So just a couple minutes on this. So these are the key things that we're glad are in our program, but these are key things we also hear from people who are using our program, that is doable, it's not overwhelming, that we focus on whole and processed fiber foods. It's a very positive approach. There's no shaming, there's no, no negativity. We really want to focus on the positive things that we're doing for ourselves. And we show, not just tell, and I'll kind of give you an example of that here shortly, and that it's not a diet. It really is a lifestyle. And so that's kind of why we have moved to Full Plate Living, that this really is a way of life. So what is our plate approach? So 75% we focus on filling with foods that really are underconsumed. These are fruits, vegetables, beans, and cooked whole grains. And one way we teach the difference between the 75% part of the plate and the additional 25% part is that the 75% part of the foods are foods that are naturally rich in fiber and water. And so this is fruits, vegetables, beans, and cooked whole grains. And these contain at least 60% of water, and again, naturally contain fiber. And these are the foods that really help you stay full longer and that really help you stick with a way of eating. Now, the 25% part of the plate, everyone's like, well, what about that? There's got to be some strict restrictions on that. And no, there's not. We just say that you can fill this section with a reasonable serving of anything. And this just allows for flexibility, autonomy, and for small habit adoption. And too, for the things that other things that we love that don't necessarily fit in 75%, these can still be part of our lives and part of part of our plate. Food is a lot of joy, and so we should enjoy all food. And so there's not necessarily a bad or good section. Both of them are good sections. And we also teach healthier options, of course, depending on your health goals. So kind of that's it in a nutshell. So let me share an example with you. So one of course, one of the most popular foods, at least in the USA, is pizza. And so let's say that this is a typical meal that you eat, but you're willing to make a change and add more water fiber foods. Maybe do a hearty garden vegetable salad to it. And then maybe when you're ready, small habit adoption, you increase those foods even more. Maybe do a bean soup, or like a minestrone soup, a split pea soup, something like that, and also a side of fruit. Now, the great thing that we see is as the fiber goes up, the calories go down. And so this is just one of the examples that we teach in our programs of really showing people how they can still enjoy the foods that they like, but also how can they really boost up those water fiber foods that we know are big game changers when it comes to health. So that's kind of full plate living in a nutshell. I'd like to go through our online self-guided program first. This is if you're looking at doing it for yourself or you're referring someone to do our online course. And so we have our core program is our flagship course. And this is kind of a little bit of a fact sheet of this. It is included in 7 modules that it's broken down into. You can do them on demand. We do recommend that you give yourself a few days, if not a week, between the modules so that you can try out what you learn. You know, we're not want to have an epiphany of changing everything, but kind of that small habit adoption. Learn one thing, try it out, what worked, what didn't work. There's learnings in all of that. And so we build that into our 7 module course. And again, this is probably about, no more than an hour per module or per week that you would spend. And of course, this is also a free service. At the end of the core program, you do get a certificate of completion that you have completed the course. And here's kind of an overview of kind of just a screen capture really of the curriculum that is taught in each of these modules. So, it's how do you work at developing these 75-25 plates? How do you navigate eating with other people, eating out, different, snacking sometimes is a big subject that we deal with as well. So this is just kind of a screen capture, just a little bit of a glimpse of what we cover. And it's a lot of interactive lessons. So we do have video lessons, we have reading lessons, and then also different exercises that you're doing, that you're working on. So why do you want to make these changes? Or what are steps you can take at breakfast? What are fiber foods that you could add at breakfast? So there's a lot of different things to help you come up with those steps that you want to take next. Now, along with the core program, you kind of have a membership support piece that's built around that. We send a weekly email out with recipes and tips. And then we also do these great expert-led workshops. And this is just a glimpse of 6 different ones that we've done that cover a variety of other different health topics. Nutrition is a key piece, and we do have dietitians come on and do cooking demonstrations or different chefs. But we also love that we can build in other experts and professionals. So having a physician come on and do one on sleep, or on men's health, women's health, menopause, behavior specialists coming on behavior changes and helping even with purpose. So we really try to bring in a spectrum of other health topics. And a lot of times we get those ideas and things from our members and what they ask us. All right, now we do have additional online courses that are kind of our level 2 courses once you complete the core piece of what Full Plate is. And these are 4 modules. So this first one is reimagining weight loss. And this just kind of digs deeper into the concept of weight loss and the challenges sometimes that people have, as well as steps that you can start taking to really hone in on helping you reach your goals. This too is available free. And this gives you kind of our curriculum for each of these modules. Of course, there are lessons within each of them as well. So yes, food and drink, but things other than just food and drink as well. And then strategies really to help you move forward. And another level 2 course that you can receive is Reimagining Diabetes. This too is a 4 module on demand. You can do at your own pace course that is free. And any of these, we do recommend kind of carving out an hour a piece for each of these so that you can, again, learn, try out what you just learned and the steps that you're choosing to take before you add more. And glance at the curriculum here. So of course, we're looking at how can we balance our blood sugars better? How can we keep those honed in better? And what are the strategies and steps that you can really start to take into a deeper dive of with food, but also other lifestyle factors. So our online program, if you're looking at doing our online program, FullPlateLiving.org is our main website that is targeted towards doing our online course. You can go there, sign up for free. Again, everything that I mentioned, every additional thing is free. There's no ads, there's no upsells. This is truly a service of our private foundation, the Ardmore Institute of Health, and sharing this with you and those that you serve. So if you're looking at sharing this resource, we have resources that you can use. So we have downloadable things like after-visit summaries, QR codes, educational handouts, and I'm gonna pop off of the slides for a second. So we have like an educational handout. If you want to do a little bit of the education, but you want to send people to the online program, this is a great handout that you can use. Or if you want something to put in your office, whether it's for a community, an employer, or a clinic, we do have table displays, and we will mail these. We'll mail the table displays to you. We also have posters in stock that we'll mail you front and back. And then we also have prescription pads that we can send you as well. So those are resources we want to put in your hand to be able to share Full Plate. We do have a form that you can fill out that you can submit, and that we will ship those to you. And if there's something you say, Amy, if I had X, Y, or Z, it would really help me, always feel free to ask. We may have a resource that might help you, but it might be something that we can also create in the future. All right, so that's our online program. So I'd like to move into courses here that that you can take and that you can use in your community, in your employer space, or even in a clinic space. The first one is going to be our group program, and this is really a done-for-you curriculum to help people live healthier. We provide all the content and material. Really, the only missing piece is you. So this program is an 8-session program. It is available in a slide deck form as well as printable workbooks, and I'll show you those. We also have promotional materials. We have free information sessions that you can host. We love that this can be done virtual or in person. And then I have an optional facilitator training certification that you can go through as well. This one is available in English and in Spanish, both now the booklet formats, the guides, as well as the slide deck. So we are really excited to offer that. That's been something new in the last year. We are constantly getting asked for items in Spanish. And so we did do a direct translation because we've had people use it before and say they need that because of just their group dynamics. So we did create that. And of course, these digital resources, materials are available to you at no cost. So the first one is our facilitator guide and participant guide. You can use these 2 items to host your group. What I love about the group program too is that as a facilitator, and I have facilitators who do this in their church, in their community centers, in employee wellness space. I have physicians that do this in clinic. Is it really, you have a coach hat on. You can know certain things and help answer questions, but really this is the coach hat. You're really walking participants. And what's fabulous about the facilitator guide is that it is literally a written script. And you're helping walk participants through their participant guide, kind of the exercises, the sessions, the worksheets that are here. And so I'm going to pop off again. So the facilitator guide is literally a written script with the time, what you need to do pre-session, post-session, is all there written for you. And it walks participants through their participant guide. And so you can download these and print these as you would like. They're just, we have a lot of different people that use this in a lot of different settings, which I think is phenomenal. Let's see. One of the cool things that I was really excited that Michelle and I worked on, was it last year or maybe even the year before? One of the things, of course, COVID kind of really brought light to this was that we need this in a slide deck form. So we took the entire program and put it in a slide deck format, all the 8 sessions. The facilitator guide you don't need when you're doing this. The complete script is written in your presenter notes with instructions and what to do. The other cool thing that we decided at that time, because sometimes doing it virtually can be a little bit more challenging in having the materials, is that you can choose to do the slide deck format with or without the participant guide. We just kind of wanted to lower, an expense that you might have of printing. And so we have it written in the presenter notes with or without the without the participant guide. So that is a really nice feature that we are excited to offer now. Again, the booklet format as well as the slide deck format, English and Spanish. Before I get to the shared medical appointment, John's going to jump on. He's going to cover this section, but I want to go over one more thing on the group program here. I do have facilitators that say, well, what do I charge for this? And really, that's your choice what you charge for. We provide you the materials, but it is your time. It's your expense of whether you're doing it online, you're having to pay for a service, or your facility that you're doing at, or anything else that you do. We have some people that will do cooking demonstrations or things like that. So really, it is up to you on what you charge in your service, and we do encourage you to do that. All right, John, I'm gonna hand it off to you, my expert on shared medical appointments.
All right. Well, I don't know about that, but we're definitely going to share some good information with you all about shared medical appointments, which I think can be relevant if you're a provider, but even if you're a patient or someone who's doing the program, these could be materials you could even bring up to your provider to potentially start a group where you get your care at. And so we'll go ahead and flip through here. We've created these in both English and Spanish, and we've also tried to design them in a way that gave you options of how long of a program you wanted to run. So I do group programs in my practice. Oftentimes they're in a series of 1 or 4 or 8 sessions. And so we've created slides for those exact purposes so you can choose what makes sense for you. And then the idea behind this is it gives providers a way to actually deliver this in a way that's reimbursable. So you can use your traditional insurance codes and billing codes, which we'll cover briefly here. But again, all of the content is free. So you can basically just do it within your clinic right now. If you're not familiar with a shared medical appointment, the idea is you bring patients together with sort of a shared topic. That could be a disease state, that could be talking about nutrition or healthy living, but some sort of billable diagnosis you could use. In general, you'll have probably anywhere from 5 to 15 people who gather in the room together. They're typically an hour, but they can be as long as 2 hours. And the whole concept of here is to bring that group educational component, which again is the structure that we provide. But then even as you're doing this, you'll still have an individual check-in with each patient. So if you attended one of these groups, you'd come, there'd be sort of this group experience, but you'd also have some personal time with the provider to sort of talk about anything that was going on, adjust your medications, have an exam done. So it's all built into that whole experience. And for the providers out there, some of the nuts and bolts or nuts and beans of this, people typically will use your normal CPT billing codes. So they would use a 99213, a 99214, and it's essentially built on complexity. You're not allowed to bill for time because you have all these patients during that same hour, but you can bill based on the individual complexity of whatever the patient's needs are. And similarly, people often don't realize that you can even have a behavioral health specialist join in on the groups also, and they can provide their own billing code concurrently. So it's a nice way to have the behavioral health team and sort of your normal primary care provider delivering this content to all the patients, but then also being able to capture revenue so you can basically help pay for the services that you're providing. And you can use insurance, so it can help make it accessible and available for patients. And if you think about the groups, the benefits really, you have more time with everyone, right? Instead of that 5 minutes, with a patient, you can have an hour or 2 hours. And you can have multiple different sorts of expertise. If you have a behavioral health counselor, we have a dietitian and a physical therapist who will come in our groups as well to offer that information to people. And the nice thing is everyone is together, so there's a sense of community. And the thing that I probably love the most about it is oftentimes patients teach each other and teach me. And so if there's a question that somebody comes up with, a cool recipe somebody found, that's shared amongst the group. Or if someone's trying to figure out, what's a good protein. I had a group yesterday and someone threw out, lentils are one of my favorite proteins. And that's wonderful, right? It's getting to share your experience with others, but then also being able to learn from them too. So there's lots of benefits that have been shown in the literature on the power of shared medical appointments. And again, in terms of resources, we have all these digital resources available to you for free online. The slides to present, and again, that 148 session, downloadable content you can use, templates that you can even use for your EMR, and then also handouts for patients to go home with. And I think even for those who are not as familiar with this, we've even gone as far as creating some free CME. So you can get 2 hours of continuing medical education, and you can learn how to deliver the shared medical appointments in your own clinic. And again, this covers some of the billing, the logistics that you need to do. And you can do it on demand. You can go online and do it whenever it's available for you. It'll take about 2 hours, but it hopefully will empower you to be able to deliver these in the clinic where you're at. And we also created one other CME too. I work in an obesity medicine clinic, and GLP-1s are a very popular hot topic nowadays. There are many people who are using them or thinking about using them. So we also created content that can be delivered and sort of infused into the FullPlateLiving curriculum that helps address some of the common challenges that can be seen with those medications, and also some of the lifestyle things that are integrally important if you are taking them to help mitigate side effects, but also optimize your results, improve your overall health. And so that is also available online. And so you can check that out. Again, it's 2 hours of CME. And again, it's free as all our resources are. So with that, Amy, I will turn it back over to you.
Thank you for covering that, John. Really appreciate it. All right, so our facilitator training certification that we have, this actually was developed after doing a lot of different medical conferences, and physicians that were experts in lifestyle medicine said, well, I understand this, but my staff doesn't understand this. And so we created a training that you could go through that kind of teaches you why we teach what we teach, whether it's why motivational interviewing is important, or the art of facilitating, the complexities of obesity. Dr. Bonnet does one on us for that. And so this is an on-demand training. It is 7 modules. It'll take about 3 hours to complete the whole thing. Of course, we recommend, spacing it out if needed, but you absolutely could go through it at your own pace. It is 100% free as well. And just kind of a glance at the curriculum here, as I mentioned, we talk about the complexities of body weight, motivational interviewing, the art of facilitating, other pillars of lifestyle medicine. And so we built in a variety of different topics where really, if you're new to this philosophy, it helps you learn. If you're looking at doing this in your community or your church or with your employer, and you can become a FullPlateLiving certified facilitator. All right, and our latest newest thing is Full Plate for Kids. This actually is it's downloadable PDF format that we have here that really we're just trying to empower children to make nutritious choices. Free downloads that we have for these 3 things here. So the Full Plate activity book, this came from kind of have the information there before, but came from a grant with Stanford, and then also with the University of Massachusetts Amherst. And this was first done at a school garden program in the summer with children. And with the grant through the Ardmore Institute of Health, and I'm going to go off screen just to kind of give you a little show and tell here. They had different activities. So it's a kind of a coloring book with different activities built in. In the middle there, it has kind of seasonal items, seasonal fruits and vegetables that are in the different seasons. But it's just a fun little activity book. There's even a few recipes in the back. Just a fun little activity book that you could use with the children in your life. This is available as a free download. And then one of the things we said, well, this is great, but we would love to learn more about how you use this with the kids. And so they created, let me pull the slides back up. They created a teacher and facilitator lesson guide that you can download and kind of see what they use in several of their sessions. And they also made a quick guide for healthcare providers that you can use too. So on the landing page of that, you can gain access to all of those resources there. And the last thing I want to share, our Ardmore Institute of Health, we provide a monthly newsletter that goes out called our Whole Health Digest. If you are interested in receiving that, so wanting more in the overall space of lifestyle medicine and whole person care, you can sign up for this, and we'll send you. We do not oversend emails, so we'll send you kind of an update on what's new, what's the latest, and things like that. So if you have any questions following, you can always follow up with us by emailing hello@fullplateliving.org. Thank you for joining us today.